In 2014, the Chicago Lighthouse set out to develop new revenue streams to support its 35 programs and services. They needed an innovative way to create new jobs for people who are blind, visually impaired, or disabled. They found that solution with the development of call centers. One of their first clients was UI Health.
So I think it was back in 2014, there was an effort underway to consolidate, let's say, incoming calls into all of our clinics. When we started with the Chicago Lighthouse and the UI Health partnership, it was intended to be just a small overflow call center.
After 2 weeks of doing that work, they were very pleased, UI Health, with our services. And they asked us to bring an additional 54 employees on to handle medical scheduling for one of their clinics.
We had to somehow get people to understand that this wasn't just a contract. This is a partnership. They are an extension of us. So when they answer UI Health, they are UI Health.
You know, over time, I think that grew to maybe 30,000 calls a month. And at our peak, I believe we're now running at 150,000 calls a month. So that growth has just been amazing.
As the partnership grew, UI Health moved 30 clinics over to the Chicago Lighthouse for call center support.
And that's how we did clinic by clinic. We rolled out one at a time. It took a lot of hard work because it's the first time Lighthouse had done medical scheduling.
So the Lighthouse, at every turn, changed with us. As we had a new need, they would add resources to be able to support that need.
Good morning, everyone. Good morning. Thank you all for coming today to help celebrate the ribbon cutting for our brand new, amazing customer service center supporting UI Health's efforts.
The statistics we show are almost 30% of the staff employed by the Lighthouse and assigned to our contract are disabled or veterans. 88% of the staff are minorities. This is also significant.
As the call center partnership flourished, one major issue stood out. The current scheduling software was not fully accessible for people who were totally blind. The Chicago Lighthouse and UI Health again worked tirelessly to solve the issue. They eventually partnered with Epic Software, and the Lighthouse DAX team went to work, testing and retesting the software platform until it was fully accessible for people who are blind and visually impaired.
It's rewarding to watch agents that are able to do what I wasn't able to do as a former agent, like schedule appointments.
Because of our work, these agents will be able to move further up in the chain of command. They will be able to take on positions of team leadership, supervisor positions, managerial positions. Being a part of the team that goes through and basically puts it to the test, and watching it work is, it gives me hope.
The original 8 staff that we hired, we have more than 50% of them still here, and they've waited to be able to schedule an appointment, and now we're able to do that. So that is just, I can't tell you how happy they are that they're able to do the work that their peers can do.
Epic is something that people who are visually impaired has been waiting for forever. So one, it makes you more independent. It promotes advancement as well as it eliminates you from calling other people to say, hey, can you check this appointment? Now you can do it yourself.
Man, I feel so empowered and like I'm a part of UI Health now, for real. Like, I am really working with the team. I'm not just limited to one area. I'm equal with the other sighted agents here. And that makes me feel just empowered and awesome.
I guess accessibility in the workplace it's not only important, it's really the only answer for anyone who's blind or visually impaired.
I mean, we may have started something really big here.
So I think the importance of this, as you think about how Epic is used by pretty much every major health system around the country and also now internationally, is that this is a game changer.
I'm glad I was able to help, and that's all I ever really wanted to do, was to do my best to help others do their best and become the best they can be, because it was so important for the patients and for our staff to have good systems, to have a good environment, to have good support, to have good managers and trainers and leadership. That's what makes them good. That's what makes them great.
Thank you, UI Health, for your wonderful partnership.